Many Tennesseans in rural areas aren't getting the medical care they desperately need, and our new governor wants to make it a point to change that. Governor Bill Lee's first executive order, issued just hours ago, requires all state executive departments to come up with ways to better serve rural communities. New at 5, News Channel 5's Kyle Horan found two men who believe their plan could potentially save lives.
This is Three Rivers Hospital in Waverly, Tennessee, and it's about 30 minutes away from the next closest hospital, which is in Dixon. Now, the people that live around here, when they hear that this hospital has been having some financial troubles, that it may be in jeopardy, they're worried about what it might mean for them. At Loyce's Prom and Pageant headquarters, all that glimmers is the focus. If you ask Loyce Holland herself about their motto, she'll say this:
We got the best all the way around.
Holland lives in this world, but at one point, her world was almost turned upside down.
October 29th, 2012, I had taken a drug that day around 1 o'clock, and I had a reaction to it, and I didn't know what was going on. I thought I was dying, and but we finally decided to do the medicine and stop my heart and restart it. And Dr. Sal Haney was there, and I think he saved my life by us having our hospital here. So this is very much needed in our county.
Her business sits on the same road as the distressed Three Rivers Hospital. It's the only one in Humphreys County. Board members here know they've got a problem.
You're in a rural area, and so just volume on any business is always a struggle to get people to come into.
This is not a uniquely Waverly issue. Rural hospitals across the state are struggling.
We're open to anything and everything which can help get us out of this hole.
I was born and raised in Humphreys County, Tennessee.
These two men have a plan they say could change everything. They are attorney Russell Gill and Belmont professor Kelvin Alt.
We have to save it if we're going to save those communities as well and restore them.
The idea is to, basically build a system where either a not-for-profit system could invest in it or a for-profit system could invest in it. And I believe both are doable.
It works like this. Rural hospitals would change the way they operate, adding new services, basically anything health-related that could bring in more foot traffic. But also, their plan calls for underserved medical areas to be exempt from sales tax for medical equipment purposes. The plan hasn't been submitted to legislators yet, but the pair believe it could help all distressed hospitals. That way, Holland could continue making dresses without fear.
I can't imagine not having a hospital here.
Kyle Horan, News Channel 5.
Professor Alt says he has used this method to help other hospitals before, including in Detroit, and it worked.